Chicken anemia is clinically and morphologically characterized by aplastic anemia, severe immunosuppressive syndrome, and frequent complications from secondary viral, bacterial, and fungal infections. Chicken anemia agent was first isolated in Japan in 1979. Chicken anemia virus, CAV, is a small non-enveloped DNA virus belonging to the family Cercoviridie. The virus primarily replicates in the bone marrow, hemocytoblasts, and T-cell precursors of the thymus cortex in young chickens. All strains of the virus are of a single serotype and are exceptionally resistant to physical and chemical agents. Chicken anemia virus spreads both vertically and horizontally. Vertical transmission was long considered the most crucial factor in its spread. Horizontal spread within a flock occurs through the fecal-oral route. Chickens are the only natural hosts of the virus. Although CAV infection is prevalent, the clinical disease is rare and mainly seen in young chicks with vertically transmitted CAV from their parents. Symptoms in these chicks include weakness, depression, anorexia, and stunting, with mortality rates ranging from 5 to 20% and sometimes reaching 60%. The bird carcasses are pale due to marked anemia, with blood hematocrit values ranging from 6 to 27%. Pancytopenia, a reduction in blood cell counts, and reduced blood clotting capacity, likely due to thrombocytopenia, contribute to the low hematocrit values. Chickens with CAV infections often experience slow recovery, lasting 2 to 3 weeks, often due to secondary bacterial or viral infections. Skin lesions, especially in the wings, are common due to secondary bacterial infection. Horizontally transmitted infection in chickens older than 2 weeks of age is usually subclinical, but can influence productive traits and have economic significance. Birds with subclinical and remitted clinical infection are immunosuppressed, often suffering from secondary bacterial or fungal infections like gangrenous dermatitis, wing hemorrhages, and pulmonary aspergillosis. Postmortem lesions may include atrophy of the thymus, bursa, and bone marrow, along with hemorrhage in the muscles and wall of the proventriculus. Tentative diagnosis is based on flock history, clinical signs, and postmortem lesions. Virus isolation is difficult, making molecular techniques like PCR and hybridization recommended. Prevention and control of chicken anemia depend on biosecurity and vaccination. Vaccination is used to prevent vertical transmission from broiler breeders to their progeny. Maternal antibodies can protect chickens against CAV until the 3rd week of age. Breeder flocks can be vaccinated with commercial live vaccines by injection after 8 weeks of age, but no later than 6 weeks before laying begins. Please comment for questions. Subscribe the channel. Thank you for your support.